free to submit some other advice. But I do want to introduce our speakers tonight. So first, I'm going to start with Cherise. So Dr. Cherise Rose is a doctor of physical therapy and owner of Potentia Therapeutics, which, Cherise, are you in your office right now?
I am. This is my
It
dance
looks
wall.
beautiful. It looks beautiful. And Potentia Therapeutics is a health and wellness private practice company based on physical therapy, orthopedics, spine, and sports assessment, as well as women's health in Tampa Bay. And she specializes in dance medicine, hence what you see behind her, Pilates, manual therapy, and movement analysis. So Cherise, thank you for leading us through the body portion of tonight's talk. I'll turn it over to you.
Thank you so much for welcoming me to the night's event. And I will share my screen, guys. So give me a moment here. Perfect. Can you all see that? Great. Well, welcome, guys. I'm Cherise Rose again. Thank you so much, Sarah, for the welcome. And Dr. Ann Park, thank you so much for joining me tonight. You're amazing. Talking tonight about exercise and the effects on the immune system. And I will start off with slide number 1. Okay. So have you guys been feeling great at this time? Are you guys pretty busy in your lives, working from home and just kind of stuck in the house, and work-life balance seems to be a little altered right now, right? So I want to talk more about how to stay fit during this COVID response, right? I'm sure a lot of us have gyms that are closed and are not able to access our normal routines. So we'll talk more about how to stay fit and how to use those levels of exercise to maintain immune response to COVID-19. So benefits of wellness, it's very important to move. And I want to talk about that historical element of wellness. Back in 1977, there is a National Wellness Institute that defined global dimensions of wellness. Part of it is included into intellectual dimensions of wellness, into emotional, social, spiritual, occupational, and physical. So do you guys all feel balanced at this moment? I mean, these 6 dimensions are very important to maintaining a healthy, holistic state of mind, right? So the Journal of American Medical Association, JAMA, and National Institutes of Health estimates that a lot of preventable deaths that occur in individuals at this time, if they were maintaining wellness, then they'd have less of these deaths that occur in their overall daily life. High blood pressure is very important to consider. Diabetes, arthritis, and breast and colon cancer. So these are like high levels of deaths we'll see in patients who have these risk factors. There's historical evidence right now that tells us that wellness and fitness are very important to maintaining a healthy lifestyle, and the lack of physical health and a healthy diet and actually having stress in your life can also raise the risk of these unhealthy habits and cause this increased risk of health, damage to your health, and death. So what is immunity? Do you guys know what immunity is? It's a hot topic right now due to COVID-19. There's 2 types of immunity. There's active immunity and passive immunity. Active immunity actually has 2 elements of it, natural and vaccines. Very hot topic right now because of the COVID-19 situation we're in right now. Our body produces antibodies when we're introduced with a pathogen, a virus, a bacteria. The immune responses can be heightened with proper diet, with exercise, reducing stress levels, maintaining overall health as well. So let's talk about these types of immunity. Natural immunity is very important to us right now because this is an introduction to the disease element. It's actually when you actually have acquired the virus, such as COVID or any other virus. The flu is also a hot topic during the fall season. This is a natural way to acquire this infection. There's also a vaccination that we can receive, which is hopefully what we're working on right now, and getting this form would be great for us to have during this time of need. There's also passive immunity that we need to acquire. It'd be great to get this through antibodies. You'll see this happening now through patients who are receiving blood that have recovered from COVID, and they're actually recovering from COVID with this influx of blood from patients who have recovered. So what are the effects of exercise on the immune system? It's a hot topic right now as well because of the fact that we're stuck in our homes, we're living sedentary lifestyles, working from our desk, be it at a kitchen table, be it at in your bed. So we're definitely working in ways that are atypical and not ideal for us right now. I want to talk about the power hour of training. At 60 minutes of exercise, we have the most robust immune response. So, which means if you exercise acutely with moderate exercise for an hour, it seems to boost the immune response to any pathogen, any kind of disease element. If you go beyond 60 minutes, it's not detriment to your health, but we've seen some studies where those who, for instance, are marathoners and who have run beyond 60 minutes can see some reduction in immune response as well as detriment to their health. Recent studies also show that eating a proper diet with a nice enhanced gut microbiome will help with recovering from any kind of pathogen or any disease process. So having a healthy microbiome is great. Yogurt, eating a nice probiotic based diet, prebiotic as well is very important to consider. We have a friend who actually lectured with us a couple weeks ago about this topic, and we have great resources for you guys if you need them going forward. The next thing I'll talk about is how to enhance your immune response when you age. So if you work out now, you will boost your immune response when you're older. So there's research that shows that if you eat a healthy diet, if you work out, maintain reduced stress levels, you have less risk of infection as you age. Living powerfully is what I say about that. We always want to live powerfully is important for us as we age. Also reducing stress levels. So Dr. Ann Park will talk about this a little bit later for us, but having reduction in stress hormones is very important to living a life that's powerfully fighting off infection, boosting your immune response for any kind of like hassle that's, any kind of like targeted disease process that you're experiencing. So are you guys pretty stressed right now? I'm sure you might all be a little stressed because of the recovery from COVID. So I would mention to you that if you have natural ways to reduce your stress response to anything, that'll be great to focus on that as well as exercise too. So we'll talk about that a little bit later. So can mental stress cause physical pain? So I'll talk about this slide I have here. There is a direct link to mental stress and physical pain. Do you guys sometimes feel that when you stress out, be it from eustress, which is a positive stress, so like maybe planning a wedding or studying for an exam, these kind of stressors can cause physical pain like headaches, back pain, you go into kind of fight or flight mode when you have negative stressors that pretty much overwhelm your body and your life. You can have small bursts of stress or high bursts of stress. So it can be just stuck in traffic or having a chronic disease. We'll talk more about that a little bit later with Dr. Ann Park. So what's the path to a blissful body? We want to maintain physical health and maintain a body of, let's say, bliss. So having that mind-body connection, nutritional health is very important to be connected in all three areas, or 6 dimensions as well. The U.S. Department of Health and Human Services advises that we train 3 days a week of exercise at a moderate level and a vigorous level. So 2.5 hours of moderate exercise is very important throughout the week, and 1 hour and 50 minutes of vigorous exercise 1 time a week is very important. I hope you guys are all doing this during this time of crisis that we're going through here with COVID, and maintain this physical activity. It's very important to maintain your health during this time. It lowers risk of obesity, heart attack, bone disease, metabolic diseases as well. I would say moderate exercise would include things like going for a run, jump squats, jump rope, riding your bike as well, indoor cycle bike, be it a Peloton or indoor bike, or going for a cycle right outside. So how do we improve our movement patterns and improve our immune response? I have a couple of tips I'll go over with you guys right now. Have you guys heard about sitting is the new smoking? It's something that came out a couple of years ago, the fact that we leave a sedentary lifestyle, if you do lead one that has prolonged sitting, you're more prone to early death or just having longer chronic illnesses. So my tip for you guys is to try to stand up and not sit more than 30 minutes a day, if that's possible. If you do sit for 30 minutes a day, try to move around and kind of change your posture, stretch your arms out, get that tricep a little stretch, massage your temples, go for a nice walk, conference call. It would be nice to do that on a walk outside. Be mindful of your sitting tolerance and mindful of how long you're sitting duration-wise. There's nice apps that can tell us when to move. These Fitbits. There's also your phone may have an app, on it that can help control your sitting duration. That's very important to consider that as well. Breathe and be mindful. A lot of us are definitely feeling a lot of stress right now. So the precursor to movement should be breath. So I encourage you guys to breathe through your diaphragm, inhale through your nose, exhale through your mouth. So there's a nice practice of 4 seconds inhalation, holding for 4 seconds, and exhaling for 4 seconds, which resets your diaphragmatic breathing and recenters your body as well. Just breathe and be mindful. It's the first step for exercise. Exercising while social distancing is very important. So keeping that distance away from people who may be sick or may not know they're sick. Good hygiene is very important. So washing your hands as well when you exercise. Gyms are not open here in Florida. I'm not sure where you are if your gyms are opening, but they're opening up here now. So we have to maintain that contact, physical contact, remain away from people who may have any symptoms, and maintain hand washing is very important. So how much do you sit throughout the day? I'll go over a few stats here with you guys. Is sitting the new smoking? How long are we sitting, really averaging out throughout our day? So studies show that 20 minutes of any fixed position can inhibit your metabolism. So, after 20 minutes of sitting, just try to adjust in your seat, do some ankle pumps, wrist circles, just try to keep moving. Get that extra cup of tea. That's a nice antioxidant as well, so to help boost that immune system as well. If you sit for 7.7 hours a day, studies show that it can be detrimental to your health, but we average that much as well, 7.7 hours to 15 hours a day, which is very, it's pretty big number there. Another stat I want to talk about is, 3 for 30,000 for 8. So if we stand for 3 additional hours per day over the course of 1 year, we'll burn 30,000 extra calories and 8 pounds of fat. That's the equivalent of 1 run. So, if you just stand for 3 extra hours a day, it's really a benefit to your health. And it's like you went for a long run. So it's perfect without the sweat. Okay, so we're now sitting in our chairs more, and we have random ergonomic stations that we're probably using right now in our life. So standing, sitting, standing at a kitchen counter, sitting at a desk, sitting in a bed. So which posture are you? Now, I understand that there's a postural assessment we can go through with you guys in standing or sitting. So you have a normal spinal alignment. So there's kyphotic postures, there's lordotic postures. We can get more into that later if you need questions about that in the chat. But we have to assess your posture at rest first before you assess where you are abnormally. So let's review kind of symptoms of abnormal posture. And if you guys have this, let me know later on in the chat. But, rounded shoulders, neck pain, back pain, kind of a rounded belly, muscle ache. One sign I see from patients who have abnormal postures is fatigue. So they have to hold on to something if they're sitting for a long period of time, or that feel the need to sit down if they're sitting too long, or have to adjust in their chair more often than normal. This is a constant adjusting pattern. Sometimes it's symptoms of muscle fatigue. Your muscles in your spine are meant to be postural muscles, non-fatigable muscles, so they shouldn't fatigue very long. They should last very long, They should have a long duration of activation. So they should not fatigue on us very easily. So it's important if you are adjusting in your seat or having to put your hand down if you're standing for long periods of time to get your back stronger through things like planking, reverse planking, lots of exercises I can show you guys later during the chat with us. But there's a lot we can do for you. Also, I've launched a program with my company to do ergonomic assessments for home. So telehealth, we can also assess you from home by taking pictures or videos of your workstation and then adjusting you from distant learning. So how do you create a perfect routine to do throughout your day? Everyone always says to me, when do I stretch? Do I stretch before or after exercise? Do I stretch in the morning, afternoon? How do I stretch? What do I do? How do I design an exercise routine? I'll tell you about that right now. First is breath. So you want to make sure you breathe through your nose, exhale through your mouth. It's important to breathe through the diaphragm and not through accessory muscles in your chest wall. So it prevents you from overusing the chest wall muscles, which can lead to something like impingement, neck pain, or headaches. So active breath is very important. Secondly is the warm up. So you should warm up for about 5 to 10 minutes, 12 minutes max, before you go for your cardiovascular exercise, running, be it cycling, be it Pilates or boot camp. This helps you warm up your body before you actually have to engage it with more aggressive movement patterns. So cardiovascular exercise, we talked about this earlier. It should be 2.5 hours of moderate exercise, 1 hour and 50 minutes of vigorous exercise for 2 to 3 days per week. So that's very important for us to maintain our natural physical health. Stretching should be done after that. Then core stabilization, be it planks, crunches, let's say, reverse planking is one thing as well. Body weight, free weight training. This is very hot right now because of HIIT classes. They're called high intensity interval training classes. They're easily done without any equipment and done from home. So this is a very popular topic right now for trainers out there. I myself am a member of camp here in Tampa, Florida, and I have a nice website I go to every day to work out, and it's without any equipment needed. And the cool down or warm down. So you want to definitely, after a nice vigorous run, maybe walk it out, or after a nice Pilates class, stretch out on the floor, put an ice pack where needed. It's definitely a way to cool down and warm down after a routine. And I conclude with my last slide. You can reach me via the web, via my email, or schedule a call via calling my clinic via the number on the screen here. And I'm here for you whenever you need me. I'm hoping you learned something about physical health today. And I turn it on to Sarah and Dr. Ann Park.
Sarah, you're muted. This is like the dance of the Zoom dance.
Yes, feel free. There she is.
Yeah, we should.
About that. All right, Dr. Rose, thank you so much for those remarks. And we look forward to asking you questions later. So Dr. Park, if you want to pull up your slides.
I will.
So Dr. Park is here with us tonight. And some of you, if you happen to live in Tampa, Dr. Park has led a workshop there previously. She is a board certified psychiatrist who specializes in working with women. She went to Emory for medical school and did her psychiatry residency at Cornell. And Dr. Park provides cognitive behavioral therapy, mindfulness-based therapy, and medication management. Through her telepsychiatry practice, she sees clients in California, Florida, and New York. So Dr. Park, thanks for being here.
Thank you so much. Excuse me. And Charisse, that was wonderful, Dr. Rose. So I can't wait to come back and I was adjusting my posture throughout your, actually every time I see you, I adjust my posture. So that's a good impact you have on me. So welcome everyone. And I want to talk today about how we can manage and improve our emotional health, excuse me, during COVID-19 and beyond. And I wanted to ask a quick poll of everyone, and you can unmute yourselves, but I just want to find out from people, do you think that you feel more stressed during this time than you did prior to the start of the pandemic? What's been your experience with that? Or have you sort of weathered it and kind of adjusted? How's it felt?
I'll jump in. I'm feeling a little more stressed these days.
Yes. How about other people? Maybe Echo and...
I'll go. Yeah, I definitely am feeling more stressed during this time just because I'm not used to doing telehealth and having to see clients also in my bedroom and, like plan meals. Like it kind of can get overwhelming at times, but this is kind of the new reality of things.
Absolutely.
Yeah, and I was feeling the same way. Can you guys hear me?
Yes, we hear you.
Okay. So, there's a lot of uncertainties around it with this situation and how long it's going to last, and I feel like that's weighing on me. I live in a very small living quarter, and I don't have a really strong support network. So I feel like, that extreme loneliness and isolation also make it really hard. And I also work really long hours on top of it all, so it's not easy.
Yeah, it's a definite struggle. A lot of common factors, Susie, how about for you here in Sarasota?
Well, I feel very lucky. We were able to go to the office. We have offices for 8 people, and there's only 4 of us. So only during the time when Florida kind of went on lockdown did we work from home, and I did not like it. I went into the office on Tuesday and Thursday afternoon for a couple hours. We took turns by ourselves. Because I live by myself, my daughter lives in Manatee County as well, but many of my friends are older. So of course, even now, no one is saying, hey, do you want to go out and get a drink? Do you want to go to dinner? So my quiet world is almost more quiet, but I don't feel stressed. I really kind of feel more relaxed. I have my yoga mat out. I'm not great at yoga, but when I was working at home, I could always take a break whenever I wanted or needed to. But I think maybe I just need to broaden my circle of friends when we're able to open up more in the community.
But it's definitely a struggle. And Tina, I see you're new here. I don't know if you want to speak up a little bit or just add in a few words just about how it's, your experience with it, if it's been sort of an easy transition into this new world that we're in, or if you've noticed any areas that are a little more challenging.
No, I don't think it's been easy. I think it's been more of finding ways to adjust with, I know everybody keeps on using the word new normal, and I don't really hope that it's new normal, but adjusting with the lack of connection with other people.
Yes.
I'm definitely an extrovert, and that's been a hard thing for me.
Yeah. Thank you all for sharing so much, because I think the things that you have touched on are definitely what I'm hearing in my practice. All of the things you're talking about. The social isolation is really a big piece of it. And I think that caught a lot of us in the therapy world a little bit off guard, not just because, we're thinking about the imminent threat to health and of course financial stressors, but sort of the slow impact of being more isolated it has its impact. And Maggie, that's probably why I ended up crashing your webinar. I'm like going around to people's webinars these days, but we're social beings, right? So we need that socialization. So in any case, the stress that you guys are experiencing, you are not alone. It's a mental health month this month in May, but a poll done by CNBC and also one put out through PBS showed that between 34% to 56% of people that they polled report feeling significantly more stressed than they had been before the pandemic started. They describe things like social isolation, worrying about the health of a loved one, worrying about their financial status. And some people reported impact on physical symptoms like sleeping, eating, and even use of alcohol and substances. An interesting point or interesting anecdote is that both Starbucks and Chipotle have started providing free mental health counseling for all of their employees worldwide. So that's upwards of 100,000 people. So I think that tells you that we sense that there's going to be quite a bit of psychological and emotional impact from all of this, but it's being formed. We've not really had anything like this before, so we're trying to understand it as it rolls out. So I appreciate all of you sharing with us on that, and I know I felt all of what you've described as well. So let's talk about a little roadmap of where we're going today. We are going to start out by talking about the factors that impact our emotional health and specifically how they are COVID related at this time. I'm then going to describe some very basic facts about anxiety and depression for you, excuse me, because those are two of the most common psychological symptoms that we're seeing at this time. And then we're going to jump into how to manage emotional health using tools that all of us have at our disposal right here and now, as well as tools that you might reach for in a professional setting if it comes to something like that. And I'm going to take about 20 minutes total, so you know how long it's all going to be. And then we'll move into the Q&A where you can ask Dr. Rose all the questions you want and me as well. So what are the factors that impact emotional health? Well, right now we know that this COVID-specific ones are the ones we covered, things like threat to health, the concern about the health of loved ones, financial stressors, the social isolation. We also have people who are confronting the loss of a loved one actively, and so they are going through grief. And then we even have a case in New York in which a physician working in the emergency room, I would think probably experienced some form of PTSD where she ended up committing suicide. So you have a very wide range of emotional impacts that people are experiencing during this time. What else impacts our emotional health? Well, we know that when stressors are stacked on top of one another, that makes it more challenging for us to manage emotionally, right? And that's certainly what we have now. And then we know for some of us, there's a biochemical predisposition or a familial disposition, so that we know that if someone in your family has had a history of anxiety or depression, you yourself might be more likely to experience it yourself. So some key facts then, part 2 of our little roadmap, some key facts about anxiety and depression. We know that 1 out of 5 every adult in the US will experience a bout of clinically significant anxiety at some point in the current year. So that's 20% of adults in the country will experience an anxiety disorder at some point during the year. And we know that depression is also very prevalent in our society. About 17 million Americans will experience depression in any given year. We also know that women are twice as likely, almost twice as likely as men to experience both anxiety and depression. And there's it's sort of multifactorial, but we know that a lot of times their symptoms are tied to things like the hormonal cycle. So we'll see spikes around adolescence, spikes during the premenstrual part of a cycle, postpartum and perimenopausal as well. So a question I frequently get is, okay, how do I tell the difference between when I'm just having a bad day, I'm feeling kind of blue, or I'm feeling kind of stressed out? How do I know that that's different than clinically significant anxiety and depression? So the key factors that we look for when we're making that distinction are when someone is saying to me, you know what, I just can't shake how I'm feeling. I've been feeling badly. I've been feeling really worried. I've been feeling really down, and I just can't shake it. No matter what I do, it's very difficult to control, and it persists. That's one measure that we use to make the distinction between bread and butter stress versus clinically significant stress. Another important marker is that it impairs function. So I'll have people who report to me, you know what, I'm not as effective as I was in the workplace or at school. My relationships are beginning to suffer. My health is beginning to be impacted. So when we have symptoms that persist and impair functioning, that's when we say, okay, this is moving into something that's clinically more significant. So that's something that you can use for yourself or for loved ones in terms of, gee, when are things getting a little bit more serious here, right? Okay, so what are some of the basic tools that all of us have for free right out of our door that we can use to improve our own emotional health? So Dr. Rose talked about movement, and I'm going to speak about that very quickly just in terms of all of these 3 things we know about. I'm going to talk about some simple hacks that we can use to make them more likely to happen. But I think it's also worth the while saying that I think we all know these things, right? Get up, get out of bed, sleep properly, move, and eat properly. But at the same time, they're challenging to do. I think we could all agree on that, right? Like, who here has this all wrapped up? Raise your hand. Okay. I want to follow you if you do, but it's challenging, right? I mean, it's basic, but it's challenging. So what we can do to make these things more likely to happen, if we have tips and hacks that we can use, let's do them. So for movement, one of the things we know from the field of goal setting is that, and there is a field of study called goal setting, by the way. You might not have known that. I didn't know that. But we do better with our goals if we are more accountable. So if you have a buddy who can say, you know, guess what? Let's meet Susie tomorrow morning at the boardwalk, 6 feet away, and let's go for our walk. Or, you know, Echo, we will, you know, jump up and down, jumping jacks virtually for the next hour or whatever, you know, 30 minutes, not an hour. Those things make it much more likely that we'll actually do it too. So if you can find a buddy virtually or in real life or just by the phone, you're going to be more likely to get up and move. What about eating good food? Well, as Cherise mentioned, we have a colleague of ours who's a chef, and I'm always amazed by what she whips up, and I say to her, you know, Natalia, how do you get this done? Like I could barely, you know, find out what's in the back of my fridge. And she said the key to this is to meal plan. So if you have a plan at the beginning of the week and you set it up, it makes it much more likely that you're going to reach for good things. Now, of course, this is contingent on you making a meal plan that is, you know, healthy, not an unhealthy meal plan. Just wanted to put that qualifier in there. But a good meal plan, and then, you know what you need to have. You could stock your fridge and your pantry with it. It's going to be more likely that you get to eating whole foods that tend to decrease inflammatory responses in the body, and as a result, improve our emotional health as well as our physical health. So we know that eating anti-inflammatory foods like, you know, healthy leafy greens, whole fruits, whole vegetables, lean meats, that those have an impact ultimately on things like anxiety and depression as well. So there's a field of psychonutrition, and that's great to know that what you eat can affect how you feel. And then the third pillar of health, the third foundational health, is sleep. So we know that on average, we're all supposed to get about 7 to 8 hours a night. How many of you here get about 7 or 8 hours a night regularly? You could just raise your hand. Do you get that? Yes? And what are you guys all getting roughly? Okay, Maggie, you too. Tina, I can't see you, but on average, where do you think you're? I'm at 7. I'm probably around 6.5 to 7. How about other people?
6.
About 6.
7.
Between 6 and 7.
6 to 7. Okay.
I'm like 4 or 5.
Oh, okay.
I'm about 7 and I wake up at 6:30 without an alarm.
Okay.
I'm the same thing. No matter what time I go to bed, I can go to bed at 2 and I'm still waking up at 5:30, 6 o'clock.
You're programmed for it. Okay. Well, again, our sample here is pretty representative. So there was a study done by the National Sleep Foundation in 2015. They sampled 450,000 people, and they found that about 25% of those adults were sleeping 6 hours or less a night. So quite a good chunk of us are sleeping less than we really should be. What can we do to improve that? Because sleep is such an important maintainer of health and mood and anxiety busting, basically. So we know that if we go to bed and get up at the same time every day, 7 days a week, that's one easy way to regulate your sleep cycle. And another thing you can do is keep a log of how often you're sleeping. You know, a lot of times we think, oh, I'm not getting to bed that late. We jot it down right before you go to bed, and you might say, oh, wow, I'm actually getting in a little later. So turn off your devices half an hour ahead of time, hit the hay, and just get your body used to getting into bed and getting out of bed at the same time. Okay, so we talked a little bit about the idea of clinically significant anxiety and depression persisting and impairing. So let's say you've really worked on your movement and your eating and your sleep, and you're still feeling down, or you're still feeling blue, or still feeling very stressed out. That might be a good time to reach for some professional help. And I always tell people around me who love to hear it, but it's true. You know, if we broke our leg, we put a cast on it. A lot of times when we're experiencing emotional symptoms, we feel like, oh, I should be able to beat this on my own. I should be able to figure this out. And, you know, our body and our minds are all held up in the same, you know, unit. So if you find that you're struggling, or you know someone who's struggling, reach out and get that help. It's a good thing. So I'm going to talk about 3 tools that we have in the world of psychiatry and counseling that are very useful. The first type of therapy I want to talk with you is considered a first-line therapy for anxiety and depression. It's cognitive behavioral therapy. I don't know if any of you know a little bit about that kind of therapy. Have you heard about it? I know, Maggie, you have, but is anyone else familiar with it? So cognitive behavioral therapy basically holds with the idea that many of us come in, as we grow up and come into this world, we have like a specific filter through which we view our challenges. And a lot of times that filter is very unique to us. It develops kind of from our early life experiences, or if we've had pivotal life experiences, we tend to say, okay, what I learned there, it's probably applicable to many, many situations. What we know though, when people are struggling with anxiety and depression, often those filters are a little skewed. So what do I mean by that? I'll give you a couple of examples. We call these, when our filters get skewed, we call these cognitive errors. So an example of that is a black or white filter. And that is, you know, either things are going great or they're a disaster. We have a very hard time seeing in between. We're used to kind of extremes, and that's a very common cognitive error that I see with people who are struggling with anxiety or depression. Another common cognitive error is one that we call personalization, and that is when things go wrong, we may say, oh, you know what, that's real. I look at all the things that I might have done to contribute to that. I don't really pay attention to the external factors that might have played a role. In other words, I kind of grab all the bad credit for myself. And again, that's a pretty common cognitive error that we see when people are struggling with anxiety and depression. So in cognitive behavioral therapy, what we do is we help people to identify a filter that they may be using. And we then ask them, okay, let's gather some evidence. Let's try to tweak that filter a little bit and see if we can change the view through which you're taking in the world. And what we find is that that's a very effective way of helping people to beat anxiety and depression. Okay, second type of therapy is a mindfulness-based therapy. And I will share with you that when I first learned about this, I was a little hesitant, it's a little fruity. I'm not too sure, I like I like being in a field and all of that, but is this something I can really bring to my clients? Well, I'm excited to share with you that I really can. The evidence and the science for this is fabulous. And what we know is that when people engage in the world in a more mindful way, and specifically when they can train to be more mindful in their everyday experiences, they begin to activate a part of the brain that is responsible for moderating the emotional centers of the brain. And it does so in a different way than when we try to talk ourselves out of our stress and our anxiety. So mindfulness is sort of like a paradoxical way of dealing with problems. Often our first instinct when we're faced with challenges, whether they're physical or maybe they're emotional, is we try to stop it from happening. We want to just shut it down, right? We want to solve it right away. Mindfulness-based therapies come at this in a different way. So what they say is, hey, you know what? Rather than try to solve it right away, what we're going to do is learn how to sit with it. We're not going to solve, we're going to sit. So it's not the same thing as saying, hey, we love our challenges, we love our emotional difficulties, but rather we're going to learn how to relate to them a little bit differently so that they don't feel as distressing. They don't freak us out as much, to use a very non-clinical term, right? An analogy I like to use for this is Thanksgiving. So every year Thanksgiving comes around, and for many households in America, there's like an Uncle Charlie or maybe an Aunt Willow or a Cousin Bob who shows up that makes everyone just a little bit uncomfortable, but okay, they're family, let them in. We're going to sit down, we're going to have Thanksgiving together, and we'll probably do it again next year. So the idea behind mindfulness is that we kind of allow our difficult emotions to come in the door. We don't love them, but we learn how to tolerate them a little bit better through just sitting with them, getting curious about them, becoming sort of interested in them, and looking at them in a mindful way, as opposed to struggling against them and generating a lot of energy just trying to control them. And the data shows that learning how to do mindfulness-based stress techniques can be effective in managing anxiety, depression, chronic pain, and in medically ill patients, it allows them to experience a better quality of life. If you're interested in the data, and I'm sure we've got some people who are sort of science-based. I know we've got some science-based folks out there, but even if you're not science-based, you're interested in the data, it all came out of the University of Massachusetts and was spearheaded by a guy named Jon Kabat-Zinn. Is anyone familiar with the meditation space? You might have heard that name. So I'll send it out to you in the resources after this, but he started that program up at University of Massachusetts, and they have worked with 24,000 medically ill patients, and they've had 7,000 physicians refer into that program with some really outstanding effects. So a mindfulness-based therapy is here to stay and growing, and I think it's a very exciting addition to our field. Okay, so the third tool that we have in our toolkit is addressing things like neurochemical balance and neurochemical dysregulation. And that's probably one of the things a lot of people associate with psychiatry. So over the past 30, 40 years, we've identified at least 5 significant neurotransmitter systems that are correlated to our emotional states. And you've probably heard of some of these. Now I think they have like Twitter feeds. Anyway, so it's like dopamine, serotonin, norepinephrine, and we know that these neurotransmitters can help to regulate how we feel. So the medications that are out there actually correlate to these neurotransmitters, and we've become increasingly sophisticated at what we can offer our patients. So for example, if I have a patient who is very depressed, having a difficult time getting out of bed, is really sluggish and dragging, I might offer her a different prescription. If it comes to medication, I might offer that person a different medication than I might offer to someone who's very anxious and kind of keyed up and feeling jittery. There might be a better choice for that person. So it's just nice to know that the medications are not one size fits all. And there's just been a lot of improvements of what we can offer people with less side effects over time. I'm going to touch really quickly on timing in terms of medication use. And again, just to clarify, medication is not the first thing that I reach for, but I do think it's an important part of the toolkit for some people. So what we find is that medication takes about 6 to 8 weeks to have an impact. I know a lot of patients are hopeful that, hey, the minute I start this, I'm going to be doing great, but it does take some time to work. We also notice in about 30% of people that there will be side effects early on, and the side effects tend to be mild with today's generation of medications. So we'll notice things like tummy upset or maybe insomnia, maybe a little jitteriness. Side effects tend to wear off over time. And people will also say to me, I don't want to be on medication for the rest of my life. Well, that's absolutely correct, and nor should you be, hopefully. We often do not talk about maintenance medication for people unless they've had 3 discrete bouts of anxiety or depression that are clinically significant. But if it's a first time, usually what we tell people is 9 to 12 months, and then we're going to taper off very slowly and see how you manage. Which brings me to the issue of synergy between therapy and medication. So I'm really a big believer that if you're on medication, the therapy can be a very important and key piece of boosting your response. In fact, the research shows that you can use one to boost the other in terms of efficacy. We also know that having therapy skills going on while you're on medication provides you with a backup path, either as the medication is working its way up or as you're tapering off. And best of all, if you are then off medication, the therapy skills endure with you long after the medications are out of your system. So the therapy skills are like learning how to work out a muscle, learning how to think your way through anxiety and depression differently. And that's something that you can do, for the rest of your life. It's great. It's a great skill set to have. So in summary, how can you manage your emotional health during COVID-19, which from what I can see is going to be here with us for quite a while. I think it's going to be a marathon and not a sprint. So I think kind of learning how to adapt to it. I agree with what you said, Susie, or Tina. I don't love the idea of it being the new normal, but I do think kind of like with 9/11, right? That became the new normal for us, that we would have to go through long lines at the airport and take off our shoes. And, that seemed unimaginable before that, but it's our new normal. And I think learning how to deal with these sort of global crises may become part of what we have to do. And so being good to ourselves consistently and having skills at our, in our toolkit consistently is a wonderful thing for all of us to do to boost our baseline functioning. So we know movement, good food, sleep, and we know therapy and medication are some of the things that you can reach for if you are finding yourself under stress. And without further ado, I will stop talking and switch us over to our Q&A. And there's some of my contact information down there, and I'm certainly available to speak further if people are interested. So I am going to stop sharing, and we'll get back to the group.
All right, wonderful. Thank you so much, Dr. Parks, Dr. Rose. That was truly informative, just a lot to think about. Yes, these are messages that we hear constantly, but I don't think any of us have actually mastered them, and these were some new perspectives. So everyone, please, I welcome you to, or I invite you to put yourselves on FaceTime, turn on those videos, unmute yourselves, and type in some questions in the chat area, or if you'd like, I can see you all, you can raise your hand and I can invite you to unmute yourself so we're not interrupting each other. To kick us off, I am going to ask, unless somebody has a question to get started.
Susie's got a question.
Cherise, what is a reverse plank? And what's it good for? What does it help on your body and your
Can you
muscles?
do that for us? I want to see this.
Awesome question. And I actually can demonstrate now. Let me just angle my computer so you can see my yoga mats here.
Oh,
You see?
of course she has it ready.
All right. Hello. Reverse plank. Modified. Full.
Okay.
That's a reverse plank.
Benefit of that, Susie, how did you hear about that, and what's the benefit of that reverse plank? Tell us a little bit.
I didn't know what it was. That's why I was asking. Kind of like the mermaid without
Yeah.
having the head back. I just have not done that in my yoga class, so I was curious as to what it was.
Reverse plank is very important for spinal extensors. So funny you mentioned that, because I talked about postural adjustments and how this is important to consider in your daily routine of sedentary sitting. And the reverse plank will help build up the back extensor muscle so that you can sit longer, stand longer without fatigue. So that definitely will help you last throughout your day and sitting and standing, and will prevent the symptoms I talked about, which is the back pain, the rounded shoulders, the hunchback kind of arrangement of your thoracic spine, and muscle fatigue.
Thank you.
I think we all just sat up a little bit in our chairs.
I always sit up when I hear Cherise speak.
So that's so speaking, if you could just keep going on that, Cherise, what are tips for self-treating injuries at home? Because I know some of us won't want to go into the hospital as frequently, though I did hear today from Emory Healthcare, they're encouraging you to get back out for chronic appointment treatment. But what can we do if we're just noticing something and we don't want to go into the hospital right away?
So it's great. That's a great question. And I think that what we should have on hand is a great tip I use is ice cupping. So if you have a paper cup at home, be it a mouthwash size cup or basically just a drinking cup, you fill them with water, peel back the paper on the lip of the cup, and then ice cup painful areas. Why I choose ice cupping versus ice packs is that the ice cupping has two elements of treatment. It has the icing element and also the massage element. So when you ice cup an area, you're definitely taking care of the tissue through massage with the movement and the icing, which helps to reduce pain and swelling. I would also have a nice hot pack on hand, or just have a nice, I have access to a bathtub. If you do have access to a bath, that'll be the best situation, because you can immerse your body in heat, and that heat will help relax tissues, relax the mind and body. You can also add a little bit of some drops of aromatherapy oils like arnica, lavender, or eucalyptus to the bath water, and it helps to relax the tissues even further and helps you have a serene moment for a change.
Okay.
Sounds great.
I had a quick question about like posture. Does it matter? Because I know for a lot of women that we sit, like we'll cross our legs just naturally. Is there any like tips, I guess, on like whether or not crossing your legs or folding at the ankle is a better way to sit, and how that impacts your posture?
Yes. Well, any prolonged position can be harmful. It depends on your natural resting position in your hip joints, in your knee, in your spine. So I would say if you are feeling aligned without pain at rest, you're pretty safe to sit in your chair, on your bed, on a sofa, in any way you see fit. If you feel like you can maintain that position, just move every now and then. 20 minutes, I mentioned earlier about it inhibits metabolism. So, if you're sitting in cross-legged, maybe you should change that position in 20 minutes. Just kind of adjust out of that position every 20 minutes to be on the safe side. But if you're flexible enough, I work with dancers, I see lots of positions they get into on a daily basis, and they are fine and pain-free in that position. So I would say you would know if that position is abnormal for you or detrimental if you have to adjust constantly, A, or B, if you have pain associated with it.
Gotcha.
You're safe. You look great. So
Just kind of like let your body guide you.
let your body guide you. Yep. Your body is your yes, your guide.
Okay. So speaking of body as guides, this one can sometimes be difficult to understand what your body's trying to tell you. When do you go for medication versus the wellness practices and at-home remedies?
Well, Anne, do you want to, we could both answer this question, right?
Yeah, both of you.
I would
Go ahead.
say, I consider more of a conservative approach to pains. I would say access all natural treatments, be it the icing, massage therapy, physical therapy, heat packs, and, I guess over the counter medications. Anne, would you want to talk more about that?
So from the mental health perspective, I'm kind of along the same theoretical lines with you, Sharice. I feel like medication shouldn't be the first thing that you reach for. It's an important piece of it, and you don't want to eliminate it. But I think, I want to make sure that all the other avenues are being investigated. But I do think there's definitely a time in which, for example, when people are depressed to the point where they just can't get out of bed, they are thinking about things like suicide, they are losing weight, they're just not functioning. We call those symptoms neurovegetative symptoms, where sort of physically the bottom drops out of people. That's when you really begin to think about the use of medication. If there's a strong family history of anxiety and depression, that's also when we think about medication, because we begin to feel like there's a more biochemical predisposition and determination for what's going on. But even with the use of medication, the goal is always to try to taper it off as quickly as possible. But again, as I mentioned, there are times in which, hey, you're having your third bout of serious depression, your fourth bout of serious depression. We really should be talking about keeping it on as a maintenance way, of sort of a constant re-regulation of your neurochemical system. So that's when that's how I make the distinction between medication versus all the other tools that we have at our disposal.
Great, I agree.
And Anne, would you mind just adding your information to the chat area again so Tina can follow up with you?
Absolutely. I can add that right here. Okay.
So curious, I know that we have men and women represented, but majority women join the call tonight. Why do women experience, I think you referenced a stat, they experience anxiety twice as often as men do, and I feel like I just hear that over and over again targeted towards women. Why is that?
Yes, and Patton, no, you're definitely still invited, because I know that you have women in your life, right? There's a mom or a sister, a cousin or a friend or a partner or someone in there. So yeah, that is a really interesting finding that is consistent worldwide. And one of the unfortunate factors contributing to that is the fact that women tend to experience more sexual trauma than girls do, more than boys, and that predisposes people to anxiety and depression, as you can well imagine. There's also the hormonal fluctuation that seems to be a real link for people to experience higher upticks of those disorders. And then the biochemistry seems to be different, related again to like the presence of estrogen and the ratio between estrogen and progesterone in women versus men. But it's not fully well understood. It's just a clearly documented difference. So again, that raises my index for suspicion in a way when I have a female client, and my practice is virtually all women, but when I'm seeing a woman versus a man, my tendency to suspect that something may be more at risk is higher for the woman than it might be for the man, just simply based on statistical likelihood. So yeah.
Mm-hmm. Interesting. Do you have a feeling that any newer issues, or you're going to see some issues start trending upwards that you were not seeing before we went into quarantine and COVID?
Yes, I think so. And I think the same would be for Sharice too. But I mean, without a doubt, the stress levels have increased for all of us. I mean, I think we all share common experiences here. And we know that stress is linked to higher rates of depression and anxiety. And I'm just hoping that, someone said, every day is history right now. And it's true, right? Like everything is unprecedented. And so I think we're going to all have to slowly figure out how to adjust to this and create like a new baseline for ourselves. And I think some of the things that we touched on today can certainly be of use. Cherise, what do you think from the physical movement part of things? I mean, are we all going to be much more constrained, you think? Or, there'll be more of us working from home, less of us moving around?
Yes, I agree. Since I've been open as a clinic, because we're deemed essential. So I've seen patients come in who have started new workout programs, who are now running because it's the only option they have right now. And I've seen running injuries, ankle sprains. I've seen falls off of bikes. I've also seen now an influx this week of patients who have held off on their treatment because of, fear, of getting out in those early weeks of COVID. And they're not coming in to kind of like treat injuries that have been long standing now for 2 months or so because they held off on it getting treatment. So I'm seeing both chronic injuries and also new injuries. But everyone's getting better so far, so it's been great. But yeah, I'll see a lot of that influx of new patients coming in. We actually hired a new therapist recently because of it.
Yeah, that's it.
Okay. All right. So, and I will say, I know for me, there seem to be a lot of resources out there right now, but then it can be overload. I have so many windows up on my screen of articles to read later and workout classes that are being offered for free. What are the best ones? And I would love to hear from the speakers, as well as if anyone on the line wants to recommend an app or a website or something else for us.
Well, there's great apps right now. I'm sure Anne will agree. There's a lot of wellness meditation apps. One is called Calm, and it's been offered for free for, I think, healthcare providers as well as the public in the initial stages of COVID-19 in the first few weeks, early weeks of our response to that. But also, I personally follow one called Camp to Go. It's about Camp, C-A-M-P, the number 2 and go. And it's a local gym here, but they have access to yoga, HIIT classes, Pilates. It's all done virtually. And it's been actually, honestly, the same workout I get when I go to the actual gym. And it's been great. And that's a local app here, a local website, but I'm sure there are plenty in your city. I can send those resources to you guys via email as we follow up to this webinar as well, if you'd like them to be emailed to you guys.
Yes, I'll do the same. I have some wonderful resources. The UCLA has a mindfulness research center, and they offer free guided meditations for people, which I have used and found to be very helpful. And this is not exactly a mental health one, but Fender Guitar is offering free guitar lessons online. And let me just tell you, it's fun. Also ukulele and banjo.
Wow.
So, don't forget the fun. That's part of mental health too, right? But seriously, I'll send you a comprehensive list. Both Cherise and I will send it out afterwards.
I want to tag on to that and just say fun and creativity. As a working artist, I'm just cannot begin to tell you how important I think that finding ways to play, basically is what it comes down to. Is crucial.
That's right. That's a great point, Patton.
I agree.
How about anybody else have anything sort of like a favorite that they found virtually or maybe just in their backyard that's been really sort of like a lovely outlet for them?
I have taken advantage of my activities, which are in the evening because I'm working during the day, and obviously all of them haven't stopped. So I've taken advantage of being home around 5:30 and cooking dinner and eating at a more reasonable time instead of after choir practice or at 9:30 at night. So I have a full refrigerator and freezer.
It can be kind of a mindful thing, right? Cooking a good meal for yourself can be really rewarding.
Mm-hmm.
Okay, I have a recommendation for an app as well. It's called the Slowly. It's a friending app. It's not a dating app. Okay. And the concept is that nowadays we're so used to instant messaging. When you compose a message, you want that message to be to be read immediately, to be responded to immediately. But the idea is that, okay, so you create a profile, you don't use real pictures. You put in topics of interest, the things that you want to talk about, gardening, cooking, reading, movies, whatever it is. And then you find these profiles of other people, could be on the other side of the world, and you send them a message, but the message is delivered slowly. That's the idea of the app. It's going to take as long as 2 days, 3 days, whatever it is. You almost to compose a letter to this person that you don't know about. You can talk about anything in the world. They won't see it immediately. And then once they respond to you, you won't get it immediately. So it almost forces you to intentionally think about what you want to say to a stranger. It could be anything, but you have to put your thoughts and organize it in a way that it doesn't reward instant gratification, which I found really refreshing.
That sounds great. Can you put that, you know, all of you, if you have, I don't know, Patton, if you have like a creativity website, and Echo yours slowly, if you guys would just type that in there, that would be great. I think those sound so fun. And I know that we'll be doing other webinars, and I'd love to share some of these ideas with people, just, you know, because we all can benefit from it. I don't know, Tina, Maggie, do you have any things that have been sort of a little delight for you?
Yeah, so I just recently found with a friend, well, two of my friends, that there's an app called FitOn, FITON, and it allows you to, it's all free workouts, and then you can share the exact workout that you want to have with friends, and you guys can all do it together. You can't see your friends doing the exercises, but it's kind of nice, kind of like what you said about accountability, that you guys can both check in at, you know, 5:30 and do a workout, and then talk about it after. And like, there's hundreds of workouts. So I just found that out, and that's free. So I thought that was really good too.
Okay, that sounds
Yeah,
great.
I'll write it. Yeah.
And sorry, okay, thank you.
Well, I didn't really find any apps, but I did the old antiquated pick up the cell phone and call somebody. Not that the cell phone's antiquated, telephone is. And I have to say, because I live in Tampa now, but I moved from New York City, and a lot of my friends are in New York, and I probably made the phone calls more out of concern and just connecting, but it was kind of nice instead of doing the text or the emails. It was kind of nice just to talk to somebody. And I found some of my conversations was like a 50-minute telephone call. And though in previous COVID times, I would have thought 50 minutes was way too long to talk to somebody, like what else I should be doing. But I found myself actually enjoying the 50 minutes, meaning I didn't look at it as a waste of time. I looked at it more as a way just to relax or vent or just release.
And connect.
So I totally took the point on this to kind of pull away from technology, because in my world, I'm always on the computer. I'm always on an app.
I think that's a great point. Thank you, Tina. I found myself thinking of like a few people in New York that I will be calling later on. Same thing, you know, like the instinct to just send a text, but you know, I think we are all craving that connection, and a human voice is a lovely thing. And you know, yeah, I think that's important, and it's a great way to maintain emotional health, right? To reach out and be connected. It's a great point.
They're all amazing points.
Oh, wonderful.
Taking notes.
Yes. And I've put these resources in an email, and so I'll collect them with Dr. Rose, Dr. Park's resources, and we'll follow up with everyone. This is recorded as well, so we can share that for you to revisit the tips. And I just thank you all for joining tonight, and consider if there are other topics where you'd like to come together and connect with alums, because Echo, as you mentioned, finding new people to connect with on topics, we certainly have a community where at least you have one thing in common, so we can talk about that. Any other closing thoughts for the group or questions? Okay. All right. Well, I hope everyone has a wonderful rest of the weekend. We do have many other digital events coming up. Some are more classroom, one person presenting, some are more workshops, and some are even social happy hours. So check out our calendar, alumni.emory.edu/digital, and all the best to you all this weekend.
Yes. Thank you all for coming.
Thank you so much. That was great.
Thank you. Yes. Stay healthy. Stay well.
Thank you.
Bye, Anne. Bye, Sarah. Bye, everyone.
Bye. Thank you.